Hello everyone, I'm Dr. Jeenam Shah. I'm a consultant pulmonologist and chest physician practicing in Mumbai, India. And today we are going to be discussing about a very important topic called as lung fibrosis or pulmonary fibrosis. It comes under the umbrella of interstitial lung disease and it is a very common disorder. Approximately 1 in 1,000 people in India is suffering from lung fibrosis, which is a huge number. So let's start with the basic. Normally, when we are breathing, the lung expands, and when we breathe out, the lung collapses. So lung is like a very malleable or very spongy like a substance which moves with respiration. And when we inhale, we take in oxygen, and when we exhale, we remove carbon dioxide. But in a lung fibrosis, there is a lot of scarring in the lungs. So what happens is the lung becomes scarred and shrunken. So when you're breathing, it is not able to expand. So because of that, less amount of oxygen goes in your body and you have problems. So what are the causes of lung fibrosis? Well, there can be many causes of lung fibrosis. The most common cause is exposure to some harmful chemicals, whether it is because of some factory work like silica, asbestos, or some other chemicals working in a factory. Very importantly, sometimes it can be because of smoking and vaping also. Most important condition that can lead to lung fibrosis is autoimmune diseases like scleroderma, rheumatoid arthritis, or any kind of connective tissue disorders. One very important cause of lung fibrosis in India and very importantly in Mumbai is exposure to pigeons or any kind of other pets or birds. So the pigeon feathers as well as the waste products of the pigeons are extremely allergic, and when they enter the body, and they lead to such kind of interstitial lung disease or lung fibrosis. Certain kind of infections like HIV or other kind of immunosuppressive disorders can also lead to lung fibrosis. Certain drugs like cardiac drugs or chemotherapeutic drugs can also lead to fibrosis. Radiation after a cancer, when you receive the radiation to the lungs, can also lead to fibrosis. Sometimes there is absolutely no cause found. It is called as idiopathic pulmonary fibrosis, which is without any cause and generally happens in elderly people, males and ex-smokers. There are other types of lung fibrosis like sarcoidosis, LCH, LAM. Till today, we are not able to figure out why this happens, but they are also included in the list of interstitial lung diseases. Let's understand the symptoms of lung fibrosis. Most common symptoms is shortness of breath. Normally, when you're sitting, you don't feel breathless. When a patient is walking or climbing stairs, he'll feel breathless. That is because if your lungs are normal, when you require more oxygen while walking and climbing, your lungs are able to take in oxygen and you don't feel breathless. But in a damaged lung or a scarred lung is not able to take in oxygen. So when you require more oxygen during activities, your lung does not support you and then you feel breathless. Second important is chronic cough. You'll have continuous cough, which is generally dry because of the irritation and because of the scarring in the lungs. Fatigue or tiredness generally happens because of coughing and breathlessness throughout the day. And many times you have symptoms because of other involvement, like a connective tissue disorder. You have joint pain, skin involvement, or you have a heart involvement. Those all things can also happen. Diagnosing interstitial lung disease or lung fibrosis is very important because many disorders can be cured or can be controlled if we diagnose it early. So if you have any questions or if you have any patients or your close, near and dear ones who have such kind of problems, please ask them to visit a pulmonologist. So today we learned about what is lung fibrosis, how common it is, why does lung fibrosis happen, and what are the symptoms of lung fibrosis. If you have any questions, please feel free to comment in the question box. We will be happy to answer your questions. Thank you for watching the video.